Now we come to the questions and answers. We received quite a number of questions, but if we won't have the time to answer all the questions, it seems to be the case because we are a little bit behind schedule, we will send to all participants the missing answers via email. Now, first questions we received was to health, and it says, it asks about the differences between the countries, and mentioning mustard as an example, saying that in Germany it has a low relevance and in France a high relevance. The question is, are there new data available on that?
Okay, thank you. Yes, of course, the person asking the question is right that there are differences in the relevance of different allergens for different countries, and mustard is of course a very clear example where in the southern European countries there seems to be a relatively high prevalence of mustard allergy, while it's less common in the northern countries. However, that was not what I was referring to. What I meant to say is that if that there are no real differences between countries in the risk of certain food products with allergens for the food allergic population. So if a group of people is allergic, then the risk of certain levels of products in food products, certain allergens in food products will not differ within that population. So my remark was, and the analysis that ILSI Europe expert panel has done, were only focused on whether there are differences in risks within the allergic populations.
Okay, thank you, Kurt. The second question is to Joe, and it's about the vital calculator, and the question is whether there has been an update of the reference doses that are used there.
The most recent update would have been the Vital 2.0 version that came out about a year and a half, 2 years ago now. There is efforts to continue to update that as new data comes across. So I can tell you that the Vital Expert Panel will be looking at data and continue to look at data as it comes out. So that will be up to the Allergen Bureau about when they update if there are significant changes in what we know about the new clinical data or risk analysis.
Thank you. The next question is again to you, and it's about the exposure. And it says that the exposure is calculated by how many and how often the specific contaminated food is consumed. But is it the same that the provocation tests have a similar testing profile or only a single test? And the related question is, increasing the consumed food amount, we reduce the real milligram per kilogram action level. Is that right?
Correct. So when you're calculating if you get actionable a part per million value, as here nicely demonstrated, it is a function of both the consumption value and a gram quantity multiplied by your per million or microgram per gram of protein per gram of food. So as you increase your consumption, of course, our reference value is a defined milligram dose from that allergen So a milligram of peanut protein, for example. So as you increase your consumption, in order to maintain that level of reference dose, that milligram dose, your action level on a ppm basis would decrease. So we have to account for that, and that's why, as here it showed, it's very important to consider the differences in consumption, not only using, for example, a suggested serving, because we may be underestimating the exposure or consumption of individuals.
Thank you. I have also a question to Renee. You mentioned that accounting for severity in the risk assessment there's a gap. Are you already looking into how this could be done?
Yes, indeed. Thank you. That's a very good question, actually. We've got several activities ongoing at the moment. I mean, obviously, following on from the expert group on thresholds to action levels, we identified the need for an expert group to look at this question of severity at ILSI Europe, and there is one now ongoing. It's held 2 meetings and it's making very good progress. There are also some other activities which will feed into that, in particular the so-called single-dose challenges which are being done. I know there's one with peanut, and there are a few planned also in the IFAM project, which EU project, which many in the audience may well have heard of as well. That will consist basically of giving people who come into a clinic, unselected people, who coming with a particular food allergy into a clinic, giving them the ED05 as an open challenge, and then observing whether they react or do not react. So in addition to, I mean, while that particular type of challenge was aimed primarily at validating the ED05, it will also provide information about severity by careful recording of what reactions take place. So yes, there are a number of activities in this area, and it's looking promising.